Welcome back. Now, in many parts of the world and in several countries, people are beginning to get booster shots. New Delta variant spreads and new research coming up on the effect of COVID-19 is getting people a little worried. Several governments think now it's safer to get a third shot of the COVID-19 vaccine, in some cases more than that. Some countries are mandating that people above a certain age get a different kind of vaccine. Mix and match is on as well. In a nutshell, those who can afford to, countries which are well developed, which are rich and have a good stockpile of vaccines, are managing to give its residents more and more vaccine shots, while large parts of the world remain almost completely unvaccinated. The World Health Organization thinks it's highly unfair and dangerous and has called for a moratorium on booster shots. But is this medically safe as well? Are there conditions where certain kind of people do require a booster shots? To talk about this and understand all aspects of this ongoing debate, I'm joined now by Dr. Giridhara Babu and Dr. Arvinder Soin. Welcome to both of you, and thank you so much for speaking with us on the show this evening. Dr. Babu, your take first. Do you think the move towards booster shots is in a sense actually fueling the inequity, because makers who are able to produce large quantities of vaccine are focusing them on countries that can afford to give their citizens a third or fourth shot?
Yeah, thanks, Tamanna, for having me on the show. I agree with you. So currently what's happening is the CEOs or the people who are on the top management of these pharma firms or the vaccine firms, they are calling for booster shots. This is very unfortunate in this world, that instead of providing the evidence and then the World Health Organization or other governments accepting in terms of the need of booster shots, the firms themselves are calling for the booster shots. And this has been definitely feeding into the fears of many people, especially those who are healthy aware, health conscious. They would want to get an additional dose, and there have been queues in several hospitals in the West where people want a booster shot. But we need to understand two aspects here. One, do we have a coherent assessment of breakthrough infections in those who are already vaccinated? And what is the risk of hospitalization or death? And therefore, what is the requirement of booster shot? So that's part A of the first point. The part B is, the infection itself is supposed to give other aspects of immunity. Now, there is frontline soldiers, which are neutralizing antibodies, and there is T-cell response. So once somebody gets breakthrough infections after 2 doses of any vaccine, what is the additional advantage in terms of immune response people are getting? That we don't know. So these are scientific. The next aspect is on equity, as you rightly said. When the most of the world, especially in the low and middle income countries, do not have access to even 1 dose of vaccine, there are more than 40, 50 countries where even 5% of the population is not vaccinated. So there are some where even 1% is not vaccinated. Is it right to go for a booster shot when we really don't know whether it's going to help or not? So this is going to create greater inequities and worsen the access to the vaccines all over the world. So this is a new challenge, and it's not just the World Health Organization, even the developing countries together will have to have a collaboration. It's not the West versus the East or the developed versus the developing. And we need global collaboration to stop this. Otherwise, there will be more chaos in the future.
Yeah, but is there an incentive to stop this? Is the question. Dr. Arvinder Soin, let me first ask you a different question, which will be relevant to our viewers. Are there certain categories of people who will require a booster shot to be safe, and it medically makes sense for them to have a booster shot?
Yes, sure, Tamanna. Transplant patients, elderly patients, patients with comorbidities, patients with immune suppressive medicine, all these may not develop enough antibody response and immunity with just 2 doses. So there are a subset of patients and population that would possibly benefit with the third dose. However, that's not just the science of it, there is more to it. And that is that if you consider that the pandemic will not really go away until 60 or 70% of the world's population is vaccinated, then it is very short-sighted of the vaccine-rich countries and even the pharmas, or for that matter, the vaccine-rich country governments to play up to the pharma to allow third shots. If they've had 2 shots, definitely the vaccines, excess vaccines should be donated to countries where they haven't vaccinated enough people. So those with no vaccination should have 1 shot, and those with 1 should have 2 shots, and only then third shots should be considered, if you look at it in a global fashion. But you see, life's not that simple. Now, for example, US has had just barely 50% of its population vaccinated, although they have enough vaccines. So if they're not going to actually vaccinate people who are not, the anti-vaxxers, they may as well donate them. On the other hand, if there is no clear path for donating these vaccines to vaccine-poor countries, then they may as well start with their third shots. What are the vaccines doing? They're just lying around. So, it's all very complicated. But overall, if there is one thing that needs equitable distribution in the world at this point, it is vaccination, for sure.
Let's take that in that context, Dr. Babu, that there is a case for booster shots in some areas for certain categories of patients. Doesn't that have to be kept in mind? And at the end of the day, won't every nation first look at securing its own population, as selfish as that may sound, but that's exactly what's happening, that our elderly should get the third shot, our kids should get vaccinated before, other countries. If they don't have it, that's sad, we feel bad about it, but too bad. That is the general outlook, isn't it?
Tamanna, I agree with Dr. Soin and I respect his opinion in terms of certain categories requiring booster shots. All I'm asking is the evidence for the need of booster shot, not just for these subgroups, but for everybody else. Those who, for example, in Germany, those who have received 2 shots of AstraZeneca now are required to take booster shot. That's the policy of the government now. Now, where is the evidence which suggests that the booster shot in those with 2 shots of AstraZeneca is going to give more benefit than what they already have? So all I'm asking is, for all vaccines, once the required regime is completed, whether it's 2 dose or if it is 1 dose in Johnson & Johnson, what is the additional benefit that people will get by giving booster shot? 1, in terms of breakthrough infection of those who are already vaccinated, what is the additional benefit in those people? So this has to be a scientific assessment. Only when we look at the evidence, then what if everybody requires booster shot? Why only give to subgroups? So our policy, our action should be guided by contextual evidence. And all I'm asking is for that. Currently, this seems to be the most preferred opinion of the experts. And as you know, in science, opinions are important, but we should be designing studies to test these hypotheses and find out whether it really helps or not.
So, this argument or this whole discussion in the context of India right now is not really relevant, because we still have a large part of our population getting the second shot or waiting to get the second shot, and a booster shot has not been mandated. But Dr. Soin, would you hope that for certain categories of patients, like you mentioned, that the possibility of a booster shot should be made available?
Sure, Tamanna, but we should first vaccinate people with their first and second shots, and only then we should think of booster shots. And I completely agree with Dr. Babu that the real world evidence that just by taking 2 vaccine shots, these high-risk groups or anybody will be susceptible to breakthrough infections of any degree of severity or death after whatever time, let's say 3 months, 6 months, 9 months, is lacking. That's the problem. So intuitively, you feel that people who are on immunosuppressive medication or who have suppressed immunity for other reasons and high-risk groups should be vaccinated the third time within 3 to 6 months, and the general population possibly between 6 and 12 months. Yes, that's the intuitive thought. That's what science knows today. But we don't actually have clear evidence from real breakthrough infections among the doubly vaccinated people that their vaccine immunity actually wanes after 3 or 6 months. We don't have that evidence.
Absolutely. It's a debate that is going to be ongoing, and it's going to get tricky and even more complicated when the time comes to vaccinate children, when there will still be people above the ages of 60, 65, and those who are more susceptible to COVID-19 out there in the world without vaccines, while children are also susceptible. And it's of course a very sensitive issue. So there are no easy answers here, but definitely questions that we need to start focusing on. Thank you so much to both of you for joining us on this discussion this evening. We'll sign off here on the India Development Debate, but a quick reminder